Giving people information about the various options for treatment for their sleep apnea is extremely important, because sleep apnea is a lifelong disease that can have very serious consequences, not only in terms of how the patients feel, because they feel tired and fatigued during the day, they may have disrupted sleep, but also in terms of improving their health outcomes overall. So the risks for high blood pressure, cardiovascular disease, neurocognitive function, car accidents, depression, all have a positive benefit by using the right treatment.
If you have obstructive sleep apnea, your breathing pauses for brief periods while you're asleep. Normally, when you breathe in, air flows in through your mouth and nose and down your throat, also called the pharynx. Air then flows down your windpipe or trachea, spreading through a tree-like structure of smaller tubes into your lungs. Each time you breathe in, negative suction pressure pulls the soft tissues in your mouth inward. The muscles in your pharynx respond by pulling the soft tissues outward, again, which keeps your airway open. When you sleep, it's normal for the muscles in your mouth, tongue, and your pharynx to relax slightly, but not enough to block your airway. If you have obstructive sleep apnea, the muscles of your mouth and pharynx may relax too much. Your tongue drops onto the soft tissue in the roof of your mouth, pressing it against the back of your throat. This completely blocks the flow of air into your lungs. The lack of oxygen in your lungs wakes you up. You may gasp for air to reestablish airflow before falling asleep again. The cycle of apnea and waking up may happen many times at night, preventing restful sleep. Factors that may contribute to obstructive sleep apnea include obesity, because more fat may be present in the walls of the pharynx, a small or receding jaw with a narrow airway, loss of muscle tone in your pharynx due to aging, and swollen tonsils. Common symptoms of obstructive sleep apnea are snoring, morning headaches, chronic daytime sleepiness, fatigue, irritability, and impaired concentration. Left untreated, obstructive sleep apnea may lead to complications such as high blood pressure, heart disease, irregular heartbeats, also called arrhythmias, stroke, and diabetes. Recommend lifestyle changes to obstructive sleep apnea include losing weight, sleeping on your side, not smoking, and avoiding substances that can make you sleepy, such as alcohol and sedatives.
Obstructive sleep apnea is commonly treated with Cpap, or continuous positive airway pressure, and while this is very effective therapy, not all patients can tolerate it. It is very important to educate a patient about alternatives to Cpap. The treatment of obstructive sleep apnea is a long-term important goal, and oftentimes requires more than one approach. If we educate patients about alternatives to Cpap, they're actually more likely to stick with therapy. So when a patient is unable to tolerate Cpap, we talk to them about continuous open airway therapy, which achieves the same goal as Cpap, just through a different mechanism. Cpap pressurizes the upper airway and moves the tissues apart. COAT actually moves the lower jaw forward, opens up the airway mechanically, and allows the airway to remain open through the night. Patients generally prefer continuous open airway therapy to Cpap and generally use it for a longer number of hours every night.